my daughter who's in college, it's estimated, statistics are true, she's going to have 10 jobs in her lifetime. And she shouldn't have to go into a 30, 60, or 90-day waiting period in between jobs before she gets health insurance. Those are the kind of reforms that we need to make. There's a bankruptcy in America every 30 seconds, not because somebody had a good time with a credit card, but because somebody in a family got sick, and over half of them had insurance.
They wait as long as they possibly can to go to the doctor, and then it's a big problem instead of a little problem that could have been taken care of early on. Thank you very much for all the work you've done.
I had a small business for a number of years too, with just 12 employees, but I know what it's like to meet a payroll every Friday, and I know how tough it was to, we provided them health insurance, but it was very tough because we were so small we didn't qualify for a group plan. And when someone gets sick the next year, you know what would happen to their premiums in these individual plans that they had to purchase. Basically, if you work for a company today that provides health insurance, nothing changes. They can continue to provide health insurance to you just like they do today. If you're a small business that currently cannot afford to provide it, or are struggling to provide it, you'll have an option to enter what's called an exchange. And when you go into the exchange, you'll see Blue Cross and Farm Bureau and State Farm and Shelter, and you may or may not see this government option.
I've been volunteering, traveling the state from Little Rock to Fayetteville, from Hot Springs to Pine Bluff, basically collecting stories from those people who support healthcare and who really need a healthcare reform. I'd like to say thank you for your stance on H.R. 3200, and on behalf of the 5,000 letters that we've collected, basically from people who have those stories that need healthcare and a change in healthcare, they'd like to say thank you as well. So I say I applaud you for keeping the course, and regardless of what's being said here today, keep doing what it is that you're doing. That's why we put you where you are.
But to answer your question, yes, there'd be a way for small businesses to be able to not only cover their employees but themselves.
No.
If you think that what we're setting up, sir, I'll be glad to listen to you.
Thanks, sir.
But nobody's talking about setting up, putting 47 million people in a public plan. Mike and I do not support a single-payer system. We're not interested in a single-payer system. We're not interested in expanding Medicare to the rest of the public. We don't support a single-payer system.
But that's what Obama wants.
So, no, it's not what President Obama wants.
And all those phone calls that people have been making into your El Dorado office, your Prescott office, your Hot Springs office, your Pine Bluff office, I was a part of that. You know, I was a part of that because I wanted people to let you know how they felt about health care. And I see that you got the message. You got H.R. 3200 through, and I just hope that whatever bill that comes before the House, comes before the Senate, that is one that's going to be affordable, accessible, and high quality to all Americans. So thank you.
I know that it's been in and out of various bills, increasing the number of federally supported GME positions in the U.S. And in my view, I think that is a very high impact measure that can really improve the number of doctors in Arkansas and the U.S. And do we know if it's in any of the House bills at this point?
The House bill, as it currently exists, and again, we don't have a final product look like it. It makes significant investments to train more primary care physicians. There will be loans, incentives, adjustments for primary care physician payment rates to encourage medical students to choose primary care as their specialties. There will also be an emphasis on increased training of primary care physicians in hospital residency programs. Primary care doctors will be able to participate in those programs, especially if they locate in a medically underserved area. This is important to me. About two-thirds of it can come from squeezing the inefficiencies out of the current system. The other third we've got to figure out. But it's got to be fair and it's got to be equitable, and the American people will not accept any new revenue put on them until they know that we have first squeezed all the inefficiencies out of a broken system.